What's up YouTube? I'm the Moving Doc, and if you fear exercise because of back pain that simply won't go away, well then I'm going to show you how to get back to doing what you love most. But please first like and subscribe this video and share it with any friends or family that you think this could also be beneficial to. So first of all, we know that back pain affects 70 to 90% of the population. That's a big number, but not all back pain is created equal, right? You can have acute back pain, you can have chronic back pain. You can have back pain due to traumatic instances, you can have back pain from degenerative issues. So the first thing we must figure out is what type of back pain are you dealing with and how do you approach your rehab different to others? So let's get into it. Firstly, acute back pain is pain when we have a sudden onset of injury. We can generally put this down to doing something that caused the injury. Might be lifting a heavy object, for example, or it might be turning around in the car to grab a jacket and you felt yourself strain a muscle or sprain a ligament and that pain came on straight away. We generally have this time frame of 4 weeks. So pain within the last 4 weeks we call acute. Whereas chronic pain is usually dull, right? It's always there, it's annoying, it's nagging, and it's been going on for an extended period of time. With chronic pain, it's sometimes due to injury, but it's not always due to injury. Sometimes we have an effect called sensitization, where the nervous system has actually changed over time, and now we're experiencing that pain sometimes with or without the injury being present. So it's super important that we understand which bracket we're in first, because this will definitely change how our rehab process goes. In saying that, other things we want to consider are factors outside of the injury. So we typically get our diagnosis, a QL strain, such as a muscle strain in the lower back, typically through this region here, or it might be an SIJ dysfunction, or it could be a facet joint sprain where a ligament has been sprained. These are very common diagnoses that we hear. Although your pain may also be psychosomatic. Now this is when stress and emotions start to impact the pain and experience that we're feeling, the discomfort. And so we want to make sure that our rehab program actually entails that. Now I reviewed over 15 different YouTube videos and I didn't get one person speaking about this. So I think it's super important that we address it in this video today. So for the best chances of management of an acute or a chronic injury, we must make sure these 5 components are included. The first one being mobilization, then stability, motor control, strengthening, and mindfulness. This makes sure that we cover all ground and that nothing is left unchecked. The first place to begin is mobilization and softening up the tissues. So if you feel quite stiff or stuck in the bed and unable to move, then beginning with gentle massages or stretches can reduce swelling and inflammation, but also relax the nervous system. When we experience injury or pain, we also have muscle that can become spasmodic, meaning they're overly contracting, giving the feeling of tightness. Mobilization can begin to normalize movement patterns and reduce the likelihood of compensating to complete everyday tasks. Next, we need to stabilize through the spine and pelvis. We can achieve this with a bird dog exercise. In this movement, we take one hand up and we take our opposite leg up. We then bring the elbow into the knee and gently round the lower back before extending at the hip and extending the arm out. As the body begins to shake, you'll notice that the core muscles such as the transverse abdominis will begin to work harder and stabilize the spine. Next, we need to move into motor control. Another super important step to managing injury is regaining control over our movements and increasing the awareness of our body in space. Think of this as enhancing our awareness like wearing a knee brace or using ankle support. It gives us that additional time before we move into a range of motion that feels painful, uncomfortable, or unsafe. Now we need to move to strengthening the lower back. Utilizing strength exercises stops the muscles of the lower back from atrophying, which means we lose muscle mass. This is super important to understand because lower muscle mass means lower strength, which means lower support, right? So we want to have maximal support in the lower back to make sure that when we go to do everyday tasks, they feel effortless. We don't want them to feel harder than they are. Otherwise, we increase that chance of re-injuring ourselves at a higher rate. Also, particularly with acute injuries or subacute injuries, strength exercises are going to be really important for blood flow and nutrients. so that that tissue can actually heal back to its normal state. Now, if you're experiencing acute back pain because it happened in the last 4 weeks, it's important to understand that going straight into heavy strength exercises puts you at risk of re-injuring that tissue and taking it back. Also, if you have a chronic back pain, you might have fears or doubts about going into the exercise, which means that you need to start at an easier variation also and build up your capacity. We call this graded exposure, where we start off lighter and we slowly reintroduce something harder. So on the easier side of strength exercises, where you might think of beginning is somewhere like a Superman hold. Laying flat on your stomach, extending out at the hips with the legs up and the arms up, making sure to get a contraction through those lower back muscles for 30 to 60 seconds at a time. From there, we can progress to strengthening the back through back extensions, going through a further range of motion, strengthening the lower back muscles through eccentric contractions, and then coming up all the way to the top. This will help when bending over to pick up certain objects or twisting, turning around. We need more range of motion strength, and this exercise is perfect. Once you feel confident, I'll suggest moving to an exercise that strengthens the muscles of the lower body, such as goblet squats. Now, goblet squats are excellent because you can get full range of motion, and holding the weight out in front of you balances out your center of mass so you can lower deeper into your squat, strengthening the full range of the squat. Now, we move on to the most difficult strengthening exercise for the back that is the most stressful, and that is our deadlift. The trap bar deadlift is the best place to start to reintroduce deadlifts or lifting of heavy objects into your everyday life. The trap bar deadlift evenly distributes your center of mass, making you feel more stable and able to drive more force through the lower body and through the lower back. It is unnecessary to train beyond the trap bar deadlift if your pure goal is to have a strong lower back and strong lower body. Okay, the last part of our rehab program, and potentially the most important, is mindfulness. Meditation is a perfect place to start with mindfulness. All you need is headphones or even just to close your eyes and sit still. So seated up against the wall with your legs straight or crossed, making sure that the back is comfortable. We take breaths in through the nose and breathe out through the mouth. When you're meditating and trying to think about how this supports back pain, you want to ask yourself some key questions. One question might be, what exercises is it that I fear most with my back pain? Another question might be, what other lifestyle changes may I make that would influence the recovery of my back pain? Sitting in a mindfulness practice will also down-regulate the amount of sympathetic activity within the body and lower your stress levels. This is going to be pivotal to 1, developing muscle if you are doing your strength exercises in your rehab. 2, reducing inflammation and swelling. And 3, reducing tightness and improving range of motion. So the key takeaway here is that back pain is highly individualized to you, and what helped others may not help you. And the last thing that I want you to know is back pain can be due to other serious factors such as infection, cancer, and autoimmune diseases. So please seek out medical advice if your pain is worsening or not getting better, because you do not want this to become a long-term disability for you. I hope this video has been helpful. Please reach out to me on Instagram if you have any questions, or comment down below. I hope your back pain heals up. Thanks for joining me today in this video.